rumors that you're hearing, that you take vitamin C, it won't help. That you eat garlic, those are rumors. Whatever they are telling you, don't believe. It is a new virus. The researchers are working day and night to give us more information. So for now, there is no treatment, there is no vaccine. When you fall sick, the treatment is supportive. Supportive means we rehydrate you and we treat the other attendant infections, because you may get a secondary bacterial infection that will make your pneumonia more severe. So we treat that. We give you oxygen, we make sure you're comfortable, you're well fed, you're well rehydrated. And then the rest is taken care of by God. Every time a mistake is made, I say, oh God, help me to keep calm and remind them later that this is not good. Because people have this habit of turning and saying, show each other the sign of peace. And we shake our hands. You know, give your friend a high five to welcome. And we give high fives. Huh? Welcome new people, people who are visiting for the first time. Show them love and we hug one another. You know, show much love, you hug again. And then somebody will say, can I borrow your pen to make some notes? Isn't it? These things we do. And remember, also remember that during the time of Ebola, some of the groups of people previously, not now, that we really lost were religious leaders. Because people will run to you to lay hands and pray. And we love it when you lay hands on us and pray, because we are receiving blessings. Even me, I would love it. But when you see me coughing and sneezing and coming to you, Pastor Serwada, you say, first keep your distance. Let me pray from here. Then you extend your hand and please turn your nose the other side so that you're safe. So what we are saying is that some of these practices, we need to continuously remind ourselves that we should not do them in our church. We have restrictions. And we have categorized countries based on the burden of COVID-19 that they carry. We have categorized countries into three. Category 1 are highly risky countries. Those are countries that have, number 1, very high cumulative numbers. Numbers of over 100 plus, even going up to 5,000 and hundreds of thousands of cases of COVID-19. Number 2, there are countries that have a high rate of increase in numbers of COVID cases every 24 hours. And we look at 24 hours because we receive what we call a situation report. All countries receive a situation report every day on what is happening. So we are able to visualize and see how countries are progressing with COVID-19. So if you're getting very many new cases every day, it means you have very active infection. And then thirdly is the exponential increase. If today you had 20 cases, tomorrow you add 40, another day you add 60, it means the number of increment is very high. And so you become a high at risk country. To date, using our criteria, 16 countries are high at risk. And these 16 countries, we are saying, if you want to come to Uganda, you're free to come. But immediately you land at the airport, we shall quarantine you. Quarantine you for purposes of observation, and in the event that you develop signs and symptoms, at least you are localized. And we can handle that without it spreading to the communities. Most people don't want to be quarantined, so they will opt not to come. 14 days is not a short time. if you're to be quarantined at your own cost. And so the countries include South Korea, Iran, Italy, the United States of America, the United Kingdom, Netherlands, Switzerland, Belgium, Spain, continue.
China, of course.
China, of course. Continue, those are only 10, there must be 16. Okay, write them down.
Oh.
Then you will share.